This Vicks Children's Nyquil is used for temporary relief of cough, sneezing, or runny nose due to the common cold, hay fever, or other upper respiratory allergies. It contains a non-opioid cough suppressant that helps stop coughing, and an antihistamine that blocks the effects of a certain natural substance that causes allergy symptoms. It also has a drying effect. Do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by the doctor. Some products are not recommended for use in children younger than 12 years. These products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions. Do not use this product to make a child sleepy. Check the ingredients on the label even if you have used the product before, as the manufacturer may have changed the ingredients. Taking the wrong product could harm you. When taking Vicks Children's Nyquil, it's important to follow the directions on the product package. If you have any questions, ask your doctor or pharmacist. If your doctor has prescribed this medication, take it as directed. You can take the tablet, capsule, or liquid form by mouth with or without food. This medication may be taken with food or milk if stomach upset occurs. The dosage is based on your age, medical condition, and response to treatment. Do not increase your dose or take this drug more often than directed. Do not take more of this medication than recommended for your age. Different brands and forms of this product may have different dosing instructions, so be sure to read them carefully. If you are using the chewable tablets, chew each tablet well and swallow. If you are using the liquid form, measure the dose carefully using a special measuring device/cup. Do not use a household spoon. If your symptoms do not improve after 7 days, get medical help right away. If they worsen or return, if you develop a headache that doesn't go away, fever, or rash, or if you think you may have a serious medical problem, it's important to seek medical attention. Some possible side effects of Vicks Children's Nyquil may include drowsiness, dizziness, blurred vision, nausea, vomiting, trouble sleeping, or headache. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. If your doctor has prescribed this medication for you or your child, it means they have determined that the benefit outweighs the risk of potential side effects. Many people using this medication do not experience serious side effects. However, seek immediate medical attention if you experience any serious side effects, such as fast, irregular, or pounding heartbeat, mental or mood changes, like confusion, hallucinations, nervousness, seizures, shaking, tremors, or trouble urinating. While a severe allergic reaction to this drug is rare, seek medical help right away if you notice symptoms such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not listed here, contact your doctor or pharmacist. Remember to consult your doctor or pharmacist if you have any concerns or questions about the side effects of Vicks Children's Nyquil. Before giving Vicks Children's Nyquil to your child, it's important to check with your doctor or pharmacist if they have any allergies or health issues. This medication may cause dizziness, drowsiness, or blurred vision, especially in older adults. It's important to be cautious when using this product if you have diabetes, alcohol dependence, liver disease, or other conditions. It's also important to talk to your doctor if you are pregnant or breastfeeding. Always consult with a healthcare professional before using this medication. It's important to be aware of any potential interactions with other medications. Always inform your doctor and pharmacist of all the products you use, including prescription and non-prescription drugs, as well as herbal products. Avoid taking certain MAO inhibitors with this medication, and be sure to discuss any other products that may cause drowsiness with your doctor or pharmacist. Additionally, check the labels on all your medicines to ensure they don't contain similar ingredients. It's also important to be aware that this medication may interfere with certain lab tests, so be sure to inform lab personnel and all your doctors that you are using this drug. If you suspect an overdose and the person is experiencing severe symptoms like passing out or having difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control centre. Symptoms of an overdose may include severe drowsiness, agitation, confusion, hallucinations, and seizures. Always seek medical help in case of an overdose. Remember to keep Vicks Children's Nyquil out of reach of children and follow the recommended dosage instructions carefully. If your child's doctor has prescribed Vicks Children's Nyquil, do not give it to other children. This medication is only meant to be used temporarily. Do not give it to your child for more than 7 days without first talking to their doctor. If your child is taking Vicks Children's Nyquil on a regular schedule and misses a dose, they should take it as soon as they remember. However, if it's close to the time for the next dose, they should skip the missed dose and take the next one at the regular time. It's important not to double the dose to catch up. The recommended daily dosage and optimal timing for Vicks Children's Nyquil should be determined by a healthcare professional. When it comes to storing Vicks Children's Nyquil, it's important to check the product package for specific instructions. Always keep medications out of reach of children and pets. It's also important to properly dispose of this product when it's expired or no longer needed. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. Consult your pharmacist or local waste disposal company for guidance on the proper way to discard this medication. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.